What made us bring this topic up again?
Dealing with health insurance, starting a health insurance brokerage. There's having a baby, priorities changing. I think it's like a melting pot of why.
I know, because I remember you said you didn't want to come from a place of not anger, but like
No.
you don't want to complain, nothing like that.
Yes, like a place of constant complaint.
Yeah, it was more so like an awareness.
Yeah, because I think it's something that it isn't talked about a lot, and I guess obviously because I have now embarked on a new journey in life, and the fact that we have children, having children, you're dealing with healthcare a lot when you're pregnant. I just think it heightens the thought processes around our journey, even in the thought process of how do we live that long without health insurance? Like, if we didn't have kids, do you think health insurance, probably because we're 30 plus, but if we didn't have kids, or if I never got pregnant, would that be at the top of our thought process?
You know, you're right. I don't know. Let's talk about it.
Let's talk about it. As you can see, I'm still very pregnant.
Yes.
Still yet holding.
You're right. I do wonder that, like, if we had kids, like, would we have taken it that much more seriously? Health insurance, or having insurance in general.
Right.
Would we have taken that seriously?
And to preface that, like, obviously you're so used to being I feel like when you're young, you're so used to being on your parents' insurance, you don't have to think about it. Like, I feel like once you become an adult, you still want your parents to do stuff for you. Like, where it'd be like, what am I even supposed to do? When you start getting jobs and they're allowing you to select health coverage, I to this day still was calling my mom like, what does this even mean? Like, what am I supposed to pick, And I think when you grow up and you're in a situation where, like, your parents have coverage, you never have to worry about it. So you think about college and all the stuff where you were going to the doctor, doing all these things, getting prescriptions and all that, and you never had a thought because it was already handled.
Right.
And so we get married 2018. I'm 26 before we get married, and I remember my mom telling me that my insurance was over, but I was an entrepreneur, so it's like, okay, well, I guess I'm about to raw dog it. Like, basically, it's the only thought process I really had. You know what I'm saying? Like, I never thought anything else. Like, okay, well, that's what it is. And the worst part was that the coverage didn't stop until like the end of that year. So like, I had coverage still for like 90 days after I turned 26. So never thought about it. When we talked about like our journey to parenthood, and when we talked about birth control, the only reason I technically got off of birth control is because I no longer had insurance.
Yeah.
So I feel like fast forward, when did we start looking into, like, we had healthcare companies?
I started looking into insurance in general when we had Caden. Like, I started taking it seriously then. Like, I understood the value of it, which I'm not actually proud of, because I'm way more responsible than that. You know what I'm saying? Like, I should have known, like, yo, make sure you straight, and whoever you are dealing with or you're married to is straight too as well.
Right.
In case anything that may happen, right?
Well, you did have a job when we got married too, though. So
and that's
technically
the thing.
we did have health coverage.
We had health coverage when I was
you had
employed.
Health coverage.
Yeah. We all were covered though, right?
No, because remember I was under my mom.
Oh, you was under your mom at that point, yeah. And we wasn't even married then.
Right.
Right. So I was covered, so I never had that thought, like you said. It wasn't until I left the job, then I was like, yo, I really ain't got no health insurance. And for a while, I'm like, I just need to stay out the way then. You know what I'm saying?
Go to the doctor.
I need to be out of harm's way.
Anything. We just lived like a very undangerous, there's no way to be hurt type life. Or sick. Even with sickness, like, I think I was at a church and like the pastor's wife was a doctor. So like one time I had like a throat ache. What is that? I had a sore throat. And I texted her like, yo, I got this congestion. I got like postnasal drip, blah, blah, blah. What do I do? and like people would send me remedies and I would get better. So it's like when you also look at that, it just be like, all right, well, shoot, I've been living this long without it. It becomes out of sight, out of mind. Yeah. And also, I think this is not a conversation that's often talked about from an entrepreneurial standpoint of like, if I am transitioning out of a job to be an entrepreneur, what is that costing me?
Yeah, you're right.
You know what I mean? Right. Like, what does that cost? Because I think in our youth, right, we're still young, but I say in our youth because obviously our mentality wasn't where it is today. And I'm thinking from a 26-year-old, 27, 28-year-old standpoint, and we're not thinking of what a transition like that looks like. We talk to people all the time who will be like, oh, I can't wait to get off this job so I can be a full-time entrepreneur and nobody can control me and da-da-da-da-da. Mm-hmm. And it's like you have all that mentality, all that mindset, all of that thought process. However,
a lot of ego involved.
I mean, beyond the ego, though, I'm more so talking about, like, with all that said, right, you're not considering what am I going to be losing in that process. Yeah. I'm only thinking of having my time freedom. I'm only thinking, like, if your business is obviously doing better than your job or whatever, I'm only thinking about, like, when you transition from your job, you are making your job's monthly income every week.
Right.
So now you're making your job monthly income 5 times. And so you can look at it and say, I'm prepared to do this because I'm earning 5 times my job income. I have saved up this amount of money. I have this, and that in play. And then I'll have my time freedom and I'll have all that. But I think rarely is it talked about from, at least, and I will say an Atlanta entrepreneur, because I don't know these other cultures. I have to say my entrepreneurial journey started in Atlanta. Yeah. But from an Atlanta entrepreneurial culture, do we talk about, okay, but what you going to do for healthcare? Right. Especially if people don't have kids. Like, it's not really a thought. It's like, just stay out the way, bro.
Yeah, you're right.
Or you have enough money to pay for whatever it's going to cost to fix whatever issue you end up having.
That's why I think literacy and entrepreneurship should go hand in hand. And what I mean by that is, like, so when I left that job and I'm starting to look up coverage, because I was obviously thinking, like, I need to get myself covered with health insurance, right? I started looking up, different coverages, and the quotes were like $1,000 a month for all of us. You know what I'm saying? Especially once you, yours lopsided or whatever. Lapsed. When yours lapsed, now I try to find health insurance for all of us.
Yeah.
And we was getting quoted like for $1,000 a month. And I don't know about y'all, but like when you
have to pay
$1,000 a month, but when you don't really have to pay $1,000 a month, but you have to pay $1,000 a month,
right?
You start to cringe a little bit. You like, I don't know if I want to pay that. I think I rolled a dice on. You know what I'm saying?
Yes.
You start thinking like, I think I rolled a dice, and that's what I didn't understand. Like, okay, how do I set up my structure? I learned this obviously eventually, but how do you set up your structure before you leave your job if you are planning on leaving your job? Because you're doing well in entrepreneurship. How do you set yourself up where maybe you're being paid through your business and maybe you got healthcare through your own business? Like you can get that on your business as well, and maybe insure yourself through your business, or you know what I'm saying, pay yourself a small salary so you can afford. So you can afford a Medicaid or something like that.
But even when you think about stuff like that, I also think it's also the connotation that certain things have, right? And what I mean by that is like let me not say growing up, but I think throughout my entrepreneurial journey, when you hear things like Medicaid and all that, it was geared toward people who didn't have money. Like, that's for poor people. I used to hear that. I've heard that from people. That's for poor people, or that's for people who don't make enough money, and blah, blah, blah. So if your mental framework is that I make enough money, then it's kind of like, I don't need that, or I shouldn't consider that, or anything like that, or it's not in my, what do you call it? Like, I'm not even vibrating on that level, right? Or like things like food stamps, or like, all these different things that people are utilizing or that are given from the government because I'm not in that financial situation. And I remember one time I was talking to somebody and they literally were like, well, I mean, you could just pay for it. Like the average physical is only about $120.
Right.
And you're not doing that every day. You're not doing it every month. So there's sometimes when you're having conversations around this with people who are riding dirty in health
Right.
insurance, it's kind of like, well, use it when you need to. And then you think about all the times when you do have a job where it's like, I'm spending this amount of money per check, and I'm rarely sick.
Yeah, you don't see it.
You don't, but you don't see it when it comes out of your check. But I'm saying, like, when you think about how much comes out of a check, and you realize how much I don't go to the doctor, how much nothing's ever happened to me, it's like realizing that insurance ain't like nobody's thinking about life insurance until somebody passes. It's like out of sight, out of mind. But if somebody passes, the whole family's asking, well, did he have an insurance policy? When you get him in a wreck, you think about how much your car insurance costs and why does it cost me this much? I only got one car, or it's only, I got 2 insured drivers on one car, or when I look at like my pay, that used to be my bill when I got out of college, was to pay the family car insurance. And so it's like, you don't think about your car insurance, you think about how much you're paying for something until. Something with happened. Everything. Same thing with healthcare. So now we end up, who are we talking to? I don't remember who we talking to. We got in that Christian insurance fund.
Crying, yes. It was, I don't know who he was talking to about it, but explaining the program, it was more so like a crowdfunding for
healthcare.
For healthcare.
But it was still expensive. It was like $400 a month.
Yeah, it was $400 a month for like a family. No, 2 people. It was for 2 people. At that point, it was $400 a month. Now, obviously, that was the cheapest quote I had seen. You know what I'm saying? But it was still rather expensive when you start to think about, like, I got to physically pay this every month. Yeah, and that's what I think gets hard for people, is that.
For entrepreneurs,
because now you have to physically see you pay that money instead of it already been taken off the check.
Right. By the time you get your check just been depleted and you just get what you got.
I want you to talk about, like, your experience because when you had the job, like, what was you paying in insurance for the family? And then also, talk about the layoff process after that, though.
Yeah. So I think obviously from before that, when I got pregnant the first time, this was in the middle of COVID, I don't know what to do, obviously, because I already knew we didn't have health care, because we stopped paying that $400 real fast.
Yeah.
Because I got a bill. Because what they didn't tell us is that it didn't go into effect for 90 days, so you couldn't do anything. And we end up going to, this was like during that whole, can we have a baby phase and all that stuff like that. So I'm going to get all these tests done, and I get a medical bill, and I'm like, what is this? I got insurance. And they're like, no, ma'am, it doesn't take effect for 90 days. So I done been paying this, and now I still got a bill. So after that, we just decided to forget that. But after I found out I did get pregnant, I called a couple of my friends who had just had babies, who were also in the same field of business we were in, and they all had went the Medicaid route. And, obviously what Malcolm said earlier, like if you're, depending on how your business is set up, right? If you're not getting paid directly from whatever it is that you're doing, and we were not. At the time, everything was coming in our business name. We had no income. I had my church income. My church income made it look like I was absolutely not well. Like, they were like, man, do you need housing? Do you need food stamps? Do you need all this stuff, right? And I'm like, in hindsight now, in my 30s, I'm like, goofy, right? Because at the end of the day, food is just so expensive. And it's like, but again, what I said, the negative connotation around that stuff, like, oh, but I got money, so I don't technically need food stamps. But I'm like, bro, that was so goofy of me, because the way food costs today?
Yeah.
Could you imagine? Somebody people be getting like $900 for food a week?
Crying. No, that's real. That's real.
Or a month, or something like that. But anyway, I say all that to say, so like, I got on Medicaid because all of our income was business income, and we didn't pay our salaries until the following year. So on paper, I was eligible, right? And so we go get the Medicaid. Obviously, all of that stuff is taken care of. So now I've lived in this land. You didn't have coverage, though. And I have lived in this land where I haven't paid for anything medical for myself or for our son for, 3 years? And obviously, one of the perks of getting back into the workforce was the fact that our whole family would be covered. But I was still covered under the coverage I already had with Medicaid. And so when you're looking through that, it's kind of like, all right, but if anything else happens, which Malcolm did, 30 years old, want to go hoop, come home and dislocates his thumb, And he's like, oh, I'm cool. This how you know we've been living dirty for so long that your response to you dislocating your thumb is popping it back in place yourself and putting it. I don't think we had any sandwich bags. He put his thumb in a cup of ice and just was like, I'll be cool. And I'm like, you need to go to urgent care. There's literally an urgent. We can walk to an urgent care, and you want to sit here with your thumb in ice. You don't know if you done did no bone damage.
Yeah, yo.
Trying to
people don't don't really talk about the real about what you go through as an entrepreneur. Like sometimes you got to do that.
And I get it, but I'm more so like I said, I feel like the older you get and the more responsibilities you have as a person.
Correct.
It's like I'm thinking literally, my mind obviously is not well. Was I already pregnant too?
I don't know. I don't think so.
That was at the beginning of this year. Yes, I was pregnant. And my mind goes straight to like, you don't know if you done messed up one of your bones that'll end up with bone cancer when you're 60.
Yeah.
Just because you did it yourself and you didn't check to make sure it was done correctly. Yeah. You know what I'm saying? That could lead to all kinds of other things and other issues later on in life. Arthritis. And so I'm like, no, you need to go get this x-ray, make sure that was the damage, right? Because you thinking it's just a dislocated thumb. It could have been fractured, all this stuff, right? This is the mom in me. And I'm like, no, we have coverage. It's a $30 copay, bro.
Literally. But I wasn't used to using coverage. I wasn't used to it.
And I get it. And that's understandable as Jax. But that was one of the perks of being able to now having had it. Mm-hmm. And I think what happens for people, if you're listening to this and you're working, is that you get so comfortable with having coverage in every which way. So old. But you get comfortable in having coverage that you don't think what would happen if something happened to this job that I have. Correct. So I think there's like pros and cons to both aspects of career path. Like if you're an entrepreneur, it's like you choose the route without it until you need it because it costs more. But if you need something, you don't have coverage. On the flip side, I think employees and people who work, we can get so comfortable in having it that you forget what it's like or you're not prepared for anything to change. And so when you ask me about like being laid off and all that stuff like that, I think all of that is heightened because I'm pregnant.
Got you. The awareness of like now I truly need coverage and I don't have it. And now you're trying to kind of scramble of like, what should I do?
Well, luckily I did have coverage in the moment.
Yeah,
you know what I'm saying?
You had
so I wasn't
secondary.
too frazzled about it, but I'm thinking like, what if somebody else was in my same position?
Got
you know
you.
what I'm saying? Who doesn't have, who might not be also having, this is rollover Medicaid from 2020 at that.
Right.
You know what I'm saying? This is not something I recently enrolled in or anything like that. So what I'm now looking at is from the perspective of not me, but the perspective of the person that might also just be pregnant, just found out they were pregnant, or you're early in your pregnancy, which I do know somebody who had that same circumstance, and you get laid off. What's up with your health care?
Yeah. Yeah, that makes sense.
Obviously, you could be in a situation where your husband works a traditional job as well, and
Correct.
now you can just roll over into their plan or, stuff like that. Like, obviously, that's not everybody's situation that both parties are entrepreneurs. But that's what I don't think we're talking about that. I don't think we're considering, what is my contingency plan in the event that something happens to this position?
Right.
Because of the level of comfort where you just get, what's the word? Complacent?
Yeah, I guess so.
Not complacent. You just get you good.
You can get comfortable. I guess
that's not the word I'm looking for. You just forget. It's so normal that when I lose a job. So now in losing the job, you lose the coverage. Luckily, we still had coverage, but then we end up in the situation recently where it's like now you have to wait on the government to renew that.
Mm-hmm. And
that's where things, where we end up having this conversation, because it's like, it's interesting that I would now be in a field that I'm dealing with, I'm being affected by.
Yeah, you're right. And I think that's what makes this important, or is now going to make the fire in you even more. Like, people need to be covered because you're going through what probably more people go through than we think. You know what I'm saying?
For sure.
Looking for coverage, or they don't even know it. They could be an entrepreneur. They could have a job, but they just don't have enough coverage for the rest of their family, whatever.
Facts.
But just speaking to entrepreneurs in general, like, a lot of us don't even know the options that are out there.
No, that's facts.
You know what I'm saying? I had no idea about the options that I had. I could have been had.
We could have been had
affordable. You know what I'm saying? Affordable coverage that would have kept us. That would have kept me covered. You know, especially when I started out in the entrepreneurship journey. So, I want you to explain some of that.
Well, the truth of the matter is you don't know what you don't know. And I remember when you were looking for coverage, you called your mom every time.
In fact.
And your parents, I think they were utilized, like outside of her job when she wasn't working, were using Obamacare because they weren't old enough for Medicare yet. And so it's like, oh, it's just Obamacare. But it's like, all right, well, how do I get it? Where do I go? What does that look like when you're in Maryland? I'm in Georgia. And I, like you said, like we just don't know our options, but you can only go as far as the information that typically our parents have. My parents have never been entrepreneurs.
Yeah.
So they really don't know what to tell me.
Yeah.
So what they offer you typically, or what you can look up, because this was the first thing my dad said when I called him and told him about, you know, a layoff or whatever. He was like, did they offer you COBRA? And I was like, what's COBRA? And I had to make sure I wrote this down so I could say it verbatim, right? So COBRA is the Consolidated Omnibus Budget Reconciliation Act. So what COBRA coverage is, it lets you stay on your job type group policy that you already had, only you're paying for it out of pocket versus, so it allows you to kind of remain under the coverage that you had with the job, only you're paying for it personally. Now, what Malcolm was saying earlier, and you have to look at too, like when you have a job, your job covers a portion of what that premium typically is. So you're never really paying the full amount of the cost, right? You know, I think I don't even remember how much my job covered, but when you're looking at that, it's like there's a percentage that is being covered that you're not paying the whole thing. When I was working, the percent based off of obviously the coverage that I selected, which was contingent upon it's 3 of us. It was also contingent upon just in case we got pregnant. That wasn't the plan, but it just so happened to happen. But I made sure I selected a cover that just in case that were to happen, and just in case we, you know, expanded our family, that we had maternity coverage and all that kind of stuff like that. That was really good. So it was costing us $1,200 a month.
That's crazy.
$1,200 a month.
That's wild.
$600 a check, and the company also paid a portion. So that's just what was coming out from me.
Yeah, because it's group coverage.
I mean, but I just don't understand why it costs this much. But it's based off of the amount of people in your household, all kinds of stuff, and like I said, what the coverage is. And typically, at least what I learned from my parents when you're looking at coverage was like, in the moment of something happening, do you want to pay high numbers or do you want to pay low numbers? It makes more sense to pay more into it with your check than how much you're going to have to pay if you have to show up to a doctor's visit or you have to go to a specialist, or now you're having a baby. Like, how much does the insurance actually cover? And so that's where you end up with a whole premium thing. The premium is based off of like, how much do you want this company to cover? Because I have friends right now that work jobs and they like, nigga, I don't get sick enough. I don't go to the hospital enough. I don't go to the doctor enough. So I'm fine with paying a $500 deductible in the event that something happens, versus I'm not fine with that. Or let's say it's $1,000, $5,000 deductible, $2,000 deductible.
You pay less premium.
But I'm only paying $100, $200 a month out of or a check out of my income.
Yeah.
So that's what the debate is, which is what I always just be like, I don't get this. And most people, I don't think we do.
Yeah, you're right.
We just pick something because we have to.
Yeah, we just pick something that makes sense towards our budget.
Correct.
Or, you know, say, how can we save money? But we don't know the intricacies of what your plan entails. Like, do you have $5,000 if you were to have to get surgery today?
Right.
You know what I'm saying? To be able to get care. Like, people don't really think about that.
Or you think about ambulance costs. So you think about if I do need a prescription, if I need to go to an urgent care, like, do I have an $80 copay or do I have a $20 copay? Does the company, like, after I pay for whatever they have like the deductible that you have to pay over the course of the year, like you have to cover this amount and then we'll cover this. Is it 20%? Is it 0%? Like, do I still, if I had a $10,000 bill, how much do I have to pay for it? Are you covering 80%? Are you covering 40%? You know what I'm saying? And that's the intricacies that we kind of skip over based off of us trying to pick a lower premium.
Gotcha.
And so this is what I learned this before I actually got into the healthcare business, because I'm like, I guess I gotta bite the bullet because I got a family. And just in case I get pregnant, like, let's just make sure we're covered. Because at the time I thought that I knew our son still had coverage with Medicaid, but I thought mine had ran out earlier that year, because according to something they had already sent me, I didn't have coverage anymore. So in my mind, I didn't have coverage, but I did. Turns out I did. I didn't find it out till I got pregnant. But anyway, basically what you're saying, like, that's how they work, right? And so what COBRA does, it allows you to stay in the same type of plan, but you don't have a job.
Gotcha.
And so the other day when you were asking me about that, I pulled it up online and I showed you, like, okay, based off of our location, based off of our family, and based off of our needs, we would still be looking at $600 to $700 a month just to be covered. How can somebody who no longer has an income from said position
afford a $600?
Now there's some that are like $50, $75 or whatever, $17 I've even seen. But once you start putting in all your information, it never says that.
Yeah.
And so that's where I start looking at, like, affordable care. And now that I'm in the industry and I'm talking to my brokers and I'm dealing, preparing for open enrollment for the Affordable Care Act, and I'm just looking around where it's like, there's so many other people that have been laid off in 2023.
You're right.
That are still, if you get on LinkedIn
especially
right
in the
now,
tech industry. Tech industry is like, I was just talking to, I saw it on TikTok. Some lady said that she had just got laid off, and it was 2,000 of them that had got laid off. I was like, what company was this? And she said, like, Centene or something like that. It was some tech company, I guess, based out of, like, Oregon or something like that. But it's just crazy to see, like, how they're cutting jobs, but they're cutting them by the thousands if they do get cut. And that's how many people are literally having their life change overnight. You know what I'm saying? And some of them could be going through what we're going through or what we had gone through, which is you could be pregnant, you could be dealing with an illness, you could be dealing with anything, and then your health insurance is cut off. Now you're scrambling, trying to figure out, like,
what to do,
where to go, what to do. And I think that's why I always preach, like, it's important to have different people in your friend group that are special in different things.
Right.
You know what I'm saying? Like, you may have a lawyer in your group. You may have
we need a lawyer in our group.
We definitely need a lawyer in our group. You may have a broker in your group. You know what I'm saying? You may have a health insurance broker like yourself. Somebody that brings value, that can help you and help you make a decision that is based upon your lifestyle and what you need. You know what I'm saying? Like,
and not even just make a decision, but have an option.
Have an option.
An option. Like, because, literally it's being, I think the situation that we dealt with that, what happened? Okay. The situation that we dealt with in regards to coverage and waiting on the government and having to go up to the buildings all these times and all this different stuff and people feeling like people don't even care about their jobs. Like, you know what I'm saying? The amount of people that you see in these government buildings that are just trying to get coverage, get their family taken care of, get government assistance, and literally watching them go up to these desks and have these conversations and hearing people say, well, this is all we can do, or you're going to have to wait, or you have to wait for so-and-so to call you, and the best I could do is send an email. And it's honestly disheartening, because it's like, this is people's lives we talking about. We're not just talking about people who just out here just trying to do something to do it.
Right.
You're talking about people who are trying to take care of their families. And so I will say, like, literally over the last month of even preparing for open enrollment with the Affordable Care Act that starts November 1st. But just even preparing for it has put a different level of drive in me, because I've, one, lived it, and two, I've seen so many people, and so to be a resource, like, I think about the musician community, the amount of people on strike. I've had conversations with my friends who have said, all they're doing as actors and people in the entertainment world is trying to make enough money in that space
to be able to afford healthcare.
healthcare. And once you get there, it still has a price. It doesn't come for free just because you can afford it. You can afford it based off of how much income you've made. So now, because of these labor unions that they have, you now qualify, but can you afford it?
Mm-hmm.
And, you know, when you just look at those whole total things in those kind of conglomerates, it's like, I'm grateful that I now have the ability to be a resource to the people around me, the people that's around them, and just the people in the world, because now I can be of service to people who are dealing with the same thing that I've lived through.
Yeah, I wonder, like, what's the difference between the Affordable Cares Act and how, like, your brokerage is set up for specifically health insurance and affordable health insurance? How is that different from, like, what people probably typically know?
It's not really different because it's really the same companies.
It's the same companies, but I remember you were saying, like, sometimes you can qualify for no premium at all, or low premium based upon income and stuff like that. Like,
yeah, most of it is all income based, obviously. Okay. Even when you go to the government, like, it's all about how much money you make for you to qualify. But even if you can make $250,000 a year and still get a policy with the Affordable Cares Act, you just have to pay a premium. Everything in regards to income is in regards to how much money are you paying a month. So if your income, and the crazy thing is, even if you go to one of the government buildings and you doing the same thing, for our household, the minimum income a month is like $6,000.
Oh, wow.
So you think, like when I was saying earlier, when I'm like, it's programmed in us to think this is for people who don't have money.
Right. But you can get Medicaid.
The minimum income for a 4-person family household. Doesn't matter who's making the most money. For 4 people in the household, $6,000 is the maximum. My bad, not the minimum. The maximum that the household can be making. That's a lot of money.
That's a lot of income for a household,
especially if 2 of those people are children.
Yeah,
you know what I'm saying. And so what we have now equated it to is that typically people don't make money. You know what I mean? And so with that income, with you making $6,000 a month, what is that? 6 times 12. Y'all get the point.
I can do the math real quick. I don't really.
What is 6 times 12? We got to get ready for preparing our kids in math class.
72,000, yeah.
So $72,000 a year. That's what you bring home, because I think typically it is off of your net income.
And that's above national average. So,
are you kidding me?
So people have no idea. Like,
and so for literally
you can get affordable healthcare.
$0 premiums.
Yeah, that's what I was saying. Like, that's crazy. Like, that stuff I didn't know. Like, as an entrepreneur, I'm thinking, like, they will hit you over the head. You know what I'm saying?
Depends on where you going.
Because of where you going. But if you have somebody that is a brokerage or somebody that can,
who just knows, you don't even
just
have to
knows,
be in all,
you know
like,
what I'm saying? Just knows about it and can get you different quotes
options,
and different options, and kind of can show you like this is what they're looking for. You know what I'm saying?
So I remember I was talking to my cousin. She was down here for our baby shower, and she's a beautician and her husband is a barber. And she was telling me, like, she's having a baby as well. She was like, oh yeah, we may have insurance. We pay $50 a month. I'm like, I was
blown away. I said, wait, what? Crazy.
Which makes us look at it like we lived dirty, hoping that nothing would happen for so long, when there are options out there that just most people don't know about or aren't talking about. Like I said, the musician community, I know so many people that are in a position where it's like, I just don't even know where I could get coverage. So I hope I don't ever have to go to the doctor. I see so many musicians that if they get sick, they thug it out.
That's real.
They thug it out.
That's so real. Especially, that's real.
You know it, because a lot of your friends are musicians.
Yeah, what?
You know what I'm saying? And so entrepreneurs, we just thug it out. I'm sick, and then I'm just in the house. I got all these remedies. You got people that's telling you, yeah, just go to Publix and get you some ginger shots and get some lemon tea and take this NyQuil, and it'll knock it right out in 3 days.
Yeah, and I hate when I hear people say you can get affordable healthcare. How? Because no one knows who to go to. You know what I'm saying? So to have somebody to go to is lit. You know what I'm saying? You need that in your friend group.
Nah, like I said, like when you live those things and you're in it beyond just trying to make money. You know what I'm saying? Yeah, and when you experience those things, it makes you, for me, it has made me really excited, upset. It's all of those emotions, things, you know what I'm saying? Where it's like, yo, people really need this. And I'm just glad to be like, for somebody to ask somebody, yo, have you ever, like, do you know what I could do for healthcare and blah, blah, blah. And somebody knowing that they could call me, oh yeah, hit my homegirl up.
Yeah.
And she can see if she can get you something that fits in your budget, you know? And to me, that's a blessing. It makes me very, very grateful to be in a position to have picked something or found something, because I didn't pick it. It kind of fell in my lap, but to have found something that puts you in that position, that's kind of next level. So I'm really excited about the years to come, for real.
Yeah, that's lit. I mean, is there anything that people should know?
If you don't have insurance and you're looking for it, open enrollment does start on November 1st.
Well, yeah, definitely, yeah.
I don't know when this episode comes out.
Right, whenever this episode comes out,
came out November 1st until January 15th. You have for open enrollment, and then everything throughout 2024 will be like a special enrollment period. So you can hit me up. I'll drop my number on here because I don't even know it.
Yeah, but people need to hear it too, though, because we got a visual and a audio.
Oh no, facts, bro. So sorry, y'all. But yeah, if you're somebody who's looking for coverage, affordable cares, you need some low premium, no premium. Like I said, I can't guarantee you anything. All we can do is see what you qualify for. But yeah, feel free to hit me up. You can email me at garrisonglobalhealth@gmail.com, or you can go to our booking information at garrisonglobalmanagement.com. It'll take you directly to my calendar. We can set up a call. Or you can literally hit my business line. It's 470-775-9455, and you text me and we can schedule a call and everything like that, and we can get you set up and see what we can find for you.
All right, let me get to the comment section and see what this comment section. We go back in the episodes of, this season, last season, whatever, and share like a question, comment, or whatever that somebody may have made based on the information that we put out to the world.
Yes.
So they said, I remember when Malcolm said in the previous season that leaving his job was a great feeling, but he regretted not having health insurance once he became an entrepreneur. What advice would you give somebody who's ready to make that leap but have the same fears? That's a good question. I would say, like I said, have a business structure that allows you to be paid as an employee from your business, so you can control what income you actually show that makes sense, so you can qualify for some of the things that could be affordable. That's a strategy. Also, befriend somebody that may be in the field of insurance, that may, deal with health insurance specifically, that you can start bouncing ideas off of and get quotes from and see what fits in your budget as you leave. Also calculating like, what do you already pay in health insurance? Because if you're leaving your job because you're doing well in entrepreneurship, you obviously have some money that you can put aside towards going through for healthcare. Yeah. So that's another option, but it's kind of really up to that person. You know what I'm saying? I think it's more so about planning and knowing, because this is stuff that I didn't take in consideration before I left. So now that you have podcasts like this, now you can take things into consideration and make like, okay, I can do this, I can afford this, or this is my strategy to be able to have some full coverage. So
yeah, I agree. I think he answered it correctly. I would do exactly what he said. And it's just proper planning. I think we need to have more conversations in entrepreneurship around how to make those transitions in total, not just jumping to live this lavish lifestyle that you think entrepreneurship is about to be.
Right, because hopefully we just told you.
Yeah, there's so many more elements to it than just there's way more elements. Like entrepreneurship is great, time freedom is great. Whatever it is that you're looking for, whatever it is that you put your energy and effort into, will put you in position to live the lifestyle that you desire. But I think in preparing to make those transitions, there needs to be more conversation around the many elements to that conversation. And so hopefully that answered your question, and hopefully this episode gave you guys some insight, and we're just giving y'all the real about the stuff that we
real life, real game. You know what I'm saying?
Yeah. The life transitions that we're transitioning through, have transitioned through, and are navigating through at the same time. So we love y'all. We appreciate y'all for listening to the show. I am your co-host, Brittany Garrison.
And I'm Malcolm Garrison.
And you can follow me at Brittany Donnell.
You can follow me at Malcolm_2_Garrison.
And don't forget to follow the show at So Let's Talk About It Pod. And you can obviously follow us on Apple Podcasts, Spotify, wherever you listen to your podcast. Make sure you subscribe to the show on there. Make sure that you subscribe on YouTube, like on YouTube, and write us. If you're listening on Apple Podcasts, make sure you rate and review so we can continue to spread love, light, and joy and value to the world. We'll see y'all on the next episode.
Peace.